Hello, AGNP students. Welcome to another week. So today we'll be focusing on a critical skill for your clinical practice, which is to distinguish between the comprehensive history and physical versus a sub-note assessment. So we'll use some of your examples to highlight the differences. Basically, what you need to know is when do you use a comprehensive HNP and when do you have to use a focused self-assessment. So I have to tell you ahead of time, you can use a SOAP template for both. It's acceptable, but there are some exceptions when you have to use only a comprehensive HNP template. So by the end of this presentation, I wanted to review some of the objectives that we'll be able to achieve, like identifying when an HNP can be used, which is what I was talking about on the previous slide, and when you can do a forecast assessment also using a sub-note template. This is very crucial as you grow your charting skills from what you're used to in as an RN and then as an APRN. So let's take a look at the comprehensive history and physical, which is your baseline document. It's very extensive. It covers every step or every aspect of the patient's medical history, family history, and your full head-to-toe review. Like if you are doing your wellness exams, this is your charting template that you have to use, the comprehensive HNP. So another way it's used, it's for new patients. If you're seeing a patient for the first time in hospital admissions, because patients are admitted and they are discharged and they might come back, but all the time we have to do a comprehensive HNP, and also for pre-op clearances, because the specialist who will be doing the procedure wants to see the comprehensive physical and history of the patient so they don't miss any detail. So how is that different from a forecast assessment? So a forecast assessment, or also some people refer to them as sub-notes, is highly targeted or focused. So you use this for patients you've been seeing for quite a while, patients returning for follow-ups, and like our patient who will be for the case study this week, John Doe, he's returning for knee pain and it's acute and he has those specific complaints, knee pain, maybe knee injury, and we'll be looking at what caused it. So in this case, we can do a forecast assessment and then we can do the sub-note. We can use the sub-note template to chart this visit, which saves time and hones in on the specific issue or concern at hand. So these are some of the structural differences that I have been talking about. It's a visual comparison. You can see, for example, the review of the systems and physical exam, how they are different from a complete head to toe, and then to a focused assessment when we are using the sub-note template. For example, for the focused assessment, it's very, very limited. For the HNP, it's the foundation of everything we need to know from that patient. But for the sub-note, we can use it for targeted or focused assessment. It's like building on what we already know from that patient. So what do we put in the subjective? In this section for HNP, you have to do a deep dive into the past medical history, social history, and family history. In our John Doe case, for example, we needed to know his 45-year pack year smoking history. In the subnote or in the focused assessment, we only need to update what might have changed. Is he, for example, still smoking, or did they stop smoking? If they do, how many cigarettes do they smoke every day? So for the objective assessment, for the HNP, it will require a comprehensive physical exam. This is very important for establishing the baseline health. For our John Doe's initial visit, we assessed his, for example, cardiovascular and respiratory systems alongside his knee pain. But for the follow-up, when we are using the subnote template, the physical exam will be or was strictly limited to the right knee and gait because we want to find out whether he's doing better. It's not that we are ignoring his cardiovascular or respiratory systems, but we are now more interested about what's going on with his knee. What do you put in your assessment and plan? For the comprehensive assessment or your head to toe, you are formulating your differential diagnosis. It's very broad differentials, and then you're addressing every chronic condition, even if they are stable. So for the focused assessment, when we are using the subnote template, we are focusing on the chief complaint. In this case, for example, osteoarthritis, which Mr. John Doe's was diagnosed with. And then briefly, we know about his hypertension and hyperlipidemia, that they remain stable. So let's take a deep dive into this case study of John Doe's initial visit. He's 65 and presents for knee pain. We need the full picture for the HNP. We documented his extensive past medical history, performed a full review of the systems, and conducted special tests like a McMurray test to formulate our initial diagnosis. And then 4 weeks later, Mr. John Doe's comes back to the clinic. So we don't have to repeat his family history or a full physical assessment. So we can take a look at what changed. For example, his pain dropped to 3 out of 10, and stiffness is down to 10 minutes. And then we'll review his new X-ray results. So regardless of any format that we use, always we have to ensure documentation is clear, concise, and relevant for clinical purposes. We should avoid, every time it's possible, copying and pasting all the notes without reviewing them, because this may lead to some errors. So your documentation should clearly reflect your clinical reasoning and then provide a precise roadmap for the patient's ongoing care. Clinical diagnostic reasoning, those are the components, the concepts that we discussed in week 1. I hope this helps as an overview of those structural differences between a subnote between a comprehensive HNP exam and charting or documentation and the forecast assessment in which we use like a SOAP template. If you have any questions, just reach out to me because this is very essential for efficient and effective advanced nursing practice. Thank you for your participation.